Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have an amazing guest today, Sandy Morgan. She is a postdoctoral associate in the Smith Respiratory Physiology Lab at the University of Florida. Sandy graduated as a registered nurse from the University of Florida more than 30 years ago. She received her master's degree in adult neuroscience nursing at the University of South Florida and worked as a clinical neuroscience nurse specialist in clinical care for many years. Um, she had a lot of nursing leadership roles, and before returning to receive her PhD at the University of South Florida, during her PhD program, she successfully developed a home-based respiratory strength training intervention for people with long COVID and shortness of breath. The data from this study has just been published this month in the Journal of Clinical Nursing Research. She is now focused on developing a respiratory muscle strengthening program for women with breast cancer. Respiratory weakness frequently occurs in the breast cancer population because of breast cancer treatment as well as the aging process. There are some early studies linking respiratory muscle weakness to lymphedema in women with breast cancer. So I'm super excited about this conversation. Thank you so much, Cindy, for being here with me.
Oh, thank you so much for inviting me.
Absolutely. So you want to tell us what inspired you to create a respiratory muscle strengthening program, especially with women with breast cancer?
Well, when I was working on my PhD, I was having a good experience working with long COVID patients. And it just so happened that a number of the long COVID patients had also had breast cancer. And so they were, in some cases, doubly impacted with some shortness of breath concerns. And when we started talking, and I started to think a little bit more about, my goodness, is there something that we should be thinking about there? And at the same time, I was doing a study with a researcher on peripheral neuropathy in breast cancer patients. And some of those ladies also were telling me about their fatigue and loss of endurance and some other things. So once I was finished with the COVID study, I thought maybe I should be thinking about this a little bit more in the breast cancer population. So that's sort of what brings me here now.
Awesome. Can you share a little bit about your nursing background and how did you lead into cancer rehabilitation and respiratory health?
Well, I was in neuroscience, but I spent a lot of years in the intensive care unit setting, and that kind of brought us to having to take care of a lot of ventilated patients, and respiratory was a major and primary concern. I learned a lot on respiratory strength in that setting. And then when the COVID pandemic hit, I was exposed to a lot of different kinds of patients that were having breathing problems long after the COVID was past. And sometimes they were having breathing problems even when they weren't during COVID, but then they developed months later. So I became very interested in what was happening with the respiratory system in those patients. And like I said, then it started to evolve into the breast cancer population was also suffering, but in a little bit different ways, but some of it was similar. So with my background now, my experiences with long COVID, shortness of breath, the intensive care unit setting, I thought maybe there's something we could be doing more to support the breast cancer survivors.
So what do you think is happening on the breast cancer patients that is affecting the respiratory system?
There's Now that I've done some work in it, there's many things that can create this. One of the first things is surgery. Having surgery in that chest area causes pain and discomfort, stiffness. People don't really always want to take deep breaths. So it's a problem right there, right after surgery. And the anesthesia, the surgery is necessary, but some of the after effects can be problems. In breast cancer patients, there's a few different things that can cause breathing problems for them. One is surgery. Having surgery in the chest area can cause problems with being able to take a deep breath. The general anesthesia itself can cause issues for up to 6 weeks after the surgery. The second big thing is the chemotherapy agents, although extremely necessary, They can have an accumulation in the muscle cells of the diaphragm. It can cause diaphragm weakness and some other problems. Um, the third thing is radiation can cause some fibrosis, sometimes long-term scarring, and just some additional breathing issues. And the fourth big thing is in the older breast cancer patient. Our breathing naturally declines as we age. After the age of 35, we start having a small incremental decrease in our breathing capabilities through stiffness and loss of flexibility. So if the breast cancer patient is older and then has to go through the necessary surgery, chemotherapy, and radiation, those things can have a combination effect that make it really hard to rebound. Fortunately, there's things that can be done about that, but proper preparation is probably a good idea to be talking about that.
Got you. Do you think as well the chemotherapy part is can influence this as well?
Absolutely. There's some studies that were done, actually, some of them at the University of Florida, in rat models, finding that those animals that received taxanes um, held those taxanes in their diaphragm muscle cells. Um, if they had those rats doing exercise prior to the chemotherapy, they did better and their diaphragm stayed stronger and they had better breathing. So some of that, we're wondering if we can't bring that over to the adult. We do know that exercise improves general outcomes, but now we're starting to talk a little bit about, can we prevent problems from happening?
And I think exactly I know what study you're talking about because that was right before COVID. And I was sitting at that research center where I forgot the name of the guy who was talking about this. And I'm like, oh my God, we got to be seeing these patients before chemotherapy and radiation in physical therapy. So the plan at that point was for us to work together to do this on humans, right? But then COVID showed up and then that did not happen. However, has been some studies done in humans up north, which shows the enhancement of radiation and chemotherapy with exercise prior to it, mainly aerobic exercise. So since I heard that, we kind of established that here, and we do that with our patients. So we actually like to get our patients, mainly breast cancer patients right now, to come and do like a high intense program, like a HIT program, prior to their infusions. And what we're finding is, again, I don't know if I cannot prove if we improving the outcomes of chemotherapy or not, but I know that their energy levels, fatigue, nausea, and a lot of these other symptoms are so much better when they've been going through this program. So has been amazing to see that. So.
Oh, that's such good news to hear. There's not that much documented for breast cancer patients, although there's much documentation in the cardiac populations about preparing for surgery, but not so much in breast cancer. And I think that's where I'm hoping that maybe I could bring a little something to see in a study. Does that actually pan out? Do the women feel better?
Mhm.
I think that it will. There's a lot of reasons to think that. And I think um, it's this shortness of breath or this fatigue feeling, maybe something more, maybe being described differently. It might be, oh, I'm so tired.
Mhm.
Oh, I just don't have the energy to do what I used to do.
Mhm.
That may be actually shortness of breath or this difficulty taking enough air in that
Mhm.
we could work on.
Yeah, that's super interesting. I'm so excited to see what kind of outcomes you get out of this study that you're working on now. So, do you think that are these breathing challenge commonly recognized by healthcare teams, or are they often overlooked?
That's a great question. There is some work out there being done in who recognizes shortness of breath. And in fact, it showed that patients don't even recognize sometimes that they're short of breath because they're dealing with so many other symptoms that they may not really recognize. Oh, I'm short of breath when I try to do what I used to do, or I'm not walking quite as far as I used to, or I'm taking breaks in between my activities. So sometimes the patient doesn't really see it. And then the healthcare professional may not see it. There's so much to focus on with the patient, so many questions about um, how they're progressing and what's happening with them that somebody may forget to ask. Hey, do you feel short of breath, or do you feel like you lack energy, or do you feel like you can't do as much as you used to? So it's just one of those almost, they call it the invisible symptom.
Yeah, yeah. So I think that the fact that the audience is hearing this now, and hopefully they can start to make a better association and a better description, right, when they go to their appointments and see like, oh, well, I'm having this fatigue and lack of energy, but at the same time, I'm feeling that I'm having some shortness of breath. So I think that that can be maybe an eye opener for the healthcare providers to kind of like, oh, maybe we need to be looking at something else then.
I agree. One of the research studies was talking about actually putting that question in the visit. Are you short of breath?
Mhm.
Do you feel like you can't do as much as you were doing before? Some of those like leading questions to help see if the breast cancer patient is experiencing it.
Okay. What does the respiratory muscle strengthening program involve? Like exercises, devices, frequency, techniques? You want to just explain that a little bit more in detail?
Oh, sure. So there's a little handheld device, and you twist the end of it, and you can make it a little harder or a little easier to breathe through. Um, it is done while the person's sitting down, which makes it a flexible exercise tool that anyone can use. Um, so even if somebody's frail or fragile, their health status is fragile, they can still almost always do respiratory muscle exercises. The exercise takes between 15 to 30 minutes sitting in a chair. The researcher helps guide how intense the trainer or the handheld device is set at. And then with some weekly coaching, how much resistance or intensity the person can go through. Um, it's our estimation based on other populations that the exercise probably starts about 10 to 15 minutes a day. And then when the person builds their breathing strength up, they can go a full 30 minutes.
Okay. And then if patients are interested or the audience is interested in this, how can they find out about it more in detail?
Well, for me, for my research study, I'll be um, once it's been approved by the institutional review board at UF, I'll be plaguing the clinic with flyers and plaguing you
Okay.
with looking for participants. These little handheld devices are also being used by athletes and
Mhm.
sometimes can be found even on Amazon. Um, but the value for doing it in the breast cancer population is doing under supervision and
Mhm.
with somebody who's monitoring throughout the process.
Oh, super excited. Cannot wait to see. Hopefully it's gonna get approved soon. What evidence or research supports this approach for breast cancer patients?
um, there are studies showing that women with breast cancer did better when they used respiratory muscle strength training either alone or in combination with aerobic to improve their outcomes. But what hasn't been published yet is doing it before treatment.
Okay.
And so that's a little gap that I think is important for us to talk about. It has been proven in other kinds of surgeries to do it before surgery to build the strength up so that the person can go through their treatment in a stronger fashion. But the breast cancer patient it's even more important there because it's not just surgery, it's chemotherapy and it's radiation and it's maybe aging. It can be all those factors put together that make it harder for the breast cancer patient. So it seems most important to work on this.
Yeah, and I think that maybe is the gapping, right? So, in general, by the time you get a breast cancer diagnosed, within a month, you pretty much are starting some kind of treatment, either surgery or neoadjuvant chemo, which is chemotherapy prior to it, or some kind of endocrine therapy. So, something happens fairly quick.
Yes,
So I wonder if because that window is such a small window versus when you have your cardiac patient. I mean,
right,
cardiac patient is not important or really dangerous, but that usually, you have a cardiac condition that has been happening for a while. This is not just over the weekend, right? So sometimes, or like if you're gonna have a lot of the pre-rehab studies that are done for total knee replacements or total hip replacements, right? So pre-rehab is amazing, but again, you have a lot of time to do.
right.
So I think that that's the part that is going to be more challenging with the breast cancer population because that time of treatment is start really fast after diagnosis.
Exactly. The the prior studies show that if we can even get 10 sessions in, 10-15 minute sessions before treatment starts, that ultrasound of the diaphragm will show that the diaphragm gets a little thicker, meaning a little stronger,
Okay.
and that the patient's a little bit prepped up and prepared for the treatment. And of course, once we would teach the breast cancer patient how to do it, we would encourage keep doing the exercise throughout treatment, but we'd like to see if we can target it before the treatment even begins, if possible.
Okay. Okay. I think then if we can do that only within 10 visits is totally doable. So, um, are you incorporating tools like inspiratory muscle trainers or specific breathing protocols besides what you explained before?
For this trial, we're going to use inspiratory muscle strength training as a starting point, since that activates the most muscles. If that's successful in the future, I'd like to add expiratory training as well as a combo approach. I think it'll be even better, but just to get a proof that this is going to be successful, we'll start with inspiratory and make it easier for the breast cancer patient too.
Okay. Will you explain that to the audience a little bit more? What is inspiratory?
Sure. When we take a breath in, that inspiration, it's an active muscle movement of the chest. When we inflate our chest by taking a breath in, it uses a lot of muscles. So when we use the inspiratory muscle strength trainer, we add resistance. So when the patient breathes in through the little trainer, we set it so it's a little hard to do. And that will be the plan for this exercise training, is make this breathing, these breaths through the trainer hard. And it specifically targets those muscles that we can't really target any other way. Expiratory muscle strength training uses another kind of trainer that you can add resistance to, where you blow out kind of like a party horn, but by adding some resistance, you make it a little harder for those muscles to work against. It builds up all the muscles in the chest and builds strength up for the person, which we think is particularly going to be supportive prior to having treatments that weaken those same muscles.
Okay. Um, have you observed improvements beyond respiratory function, such as fatigue reduction, posture, or emotional well-being on your other studies with the long COVID?
Yes, the long COVID was so exciting. The long COVID patients, we did what was called the 6 minute walk test, where you have to walk at a pretty comfortable pace for 6 minutes. And we did it at baseline and then at 6 weeks and at 12 weeks. And we found significant improvement in how far they could walk. We did quality of life measures, shortness of breath measures, dyspnea, thoracic expansion. We did that measurement. It was measuring the chest wall to see if they improved their flexibility through these exercises, and we saw a 2 centimeter
Wow.
um, growth or increase in
Mhm.
flexibility from the beginning of the study to the end of the study. And that was even the oldest participant in that study was 89. And
Wow, that's
he
impressive.
developed great increase in flexibility, but she was very dedicated to the exercise and really did a great job. So I'm hoping that those kind of results would cross over into the breast cancer population as well.
Okay, that's super interesting. Do you know, or you are you familiar with diaphragmatic release? Like so it's a technique that a lot of us manual therapists do to try to really open that diaphragm, like kind of fascia release out of the rib cage to allow that to actually function better. Do you,
Yes,
a study that you guys had done, use that as well or no?
we did not use that, but there is one study published where a researcher did diaphragmatic release on top of
Okay.
inspiratory muscle strength training and found great results. It was hard to tell which made the greater results, the
Yeah.
diaphragmatic release or the inspiratory muscle strength training, but his study had great results as well.
Okay, very good. Um, how does this program fit into the broader rehabilitation and survivorship care plan?
Well, what I'm kind of excited about as well is at University of Florida, there's also that high intensity aerobic exercise study that's going on that's super exciting. And in talking with that researcher, some breast cancer patients are a little weak to get into to start high intensity aerobic exercise right away. And she had the idea as well that perhaps doing respiratory muscle strength training as an initial step which might strengthen the breast cancer patient that's a little weaker, build up the lungs, and then maybe they would be able to slide into aerobic training as well. And the literature is definitely supporting a combined approach of general aerobic improvement, adding respiratory muscle strength training. Participants do great. So
Okay.
we've been kind of talking about that too, that maybe we can add more support.
That's very good. Yes, I've been talking to them about, like I said, I was involved a little bit in the beginning when they start developing the HIT program. She wanted me to just look. I went to the lab and that was great. It's an amazing program. So I try to see if we can do a podcast together so we can talk more about it. So it's on my site to kind of start.
Good. That's a great study.
Yes, it is. It is. How can oncology nurses, physical therapists, or exercise specialists collaborate in implementing this program?
I think this is a great opportunity for all of us, nursing, therapy, and exercise specialists to be working together to help support the breast cancer patient because there has not been as much done in this diagnosis in this area as other diagnoses. So I think we all see breast cancer patients. We all have the opportunity to be aware of what might be happening out there and kind of help provide that information for the breast cancer patients so that they can get everything that they need to have good quality of life.
And do you see potential for this model to be adapted for other cancer populations or chronic conditions?
That's a great question. Just this year, a study was published in head and neck cancer patients, and they are finding not only did they have respiratory improvements, but they had a reduction in pain medication use and some other things, swallowing and some other improvements. So um, I think there's a great opportunity. It's understudied in liver cancer and some of the other cancers. So I'm thinking once, if we can show proof of concept that it is acceptable and feasible for the breast cancer patients, that maybe that we can generate this in some of the other cancer patients that are going to undergo surgery or particularly undergo chemotherapy. Um, I think there's a lot of possibilities out there.
Oh, I cannot really wait. Super excited about to see some of the changes because this is the population we work a lot with, and it's really great to know that something that is not simple but can be simple can become such a huge outcome in how they feel, in how they can mitigate some of these side effects from chemotherapy. So oh my god, that has been an amazing information. Thank you so much for being part of this show, and thank you for all the knowledge that you're sharing today with us. So I really appreciate you being here today.
Thank you so much for the opportunity.
All right, great. So thanks again and have a good rest of the evening. Bye.